I think we pride ourselves as FQHCs of being known as a preventive care, and really want to hold that standard high that we're creating better outcomes by focusing on preventive care instead of reacting to the chronic conditions that are further down the road. If we can get our patients to understand up front their preventive care are going to limit the negative consequences of delaying those services, that's where we really feel like we're trying to get ahead of the system, focusing more upstream instead of waiting for them to float down to us when that chronic condition is out of control. And now we need to really step in and correct things.
Again, after we spent our time together in April, I got back and I got to go on site to one of our hospice partners, and it's a very competitive market, and we've been having a hard time. And I asked them, like, do we know if there's an FQHC? Well, sure enough, there was. And guess what? We had not approached them and had not even thought about them. And we sat there and started doing research and then realizing, oh my gosh, this is a great potential partnership. Hospice and palliative care people over the years have just been, I joke and say they're like the Marines of healthcare. Like, especially the nonprofit hospices, they accept people regardless of ability to pay. And they've created these amazingly transformative, innovative programs throughout the country, all from the standpoint of it doesn't matter the patient's payer source, we've taken care of them, and we've created these fascinating, innovative models.
And I think that's something that could really be built between the palliative care and hospice in FQHCs is at the end of the day, that patient's going to need that service. And if there's already that trusted relationship, we've talked about, hey, we've worked with this organization for many years. Many patients that we have seen have gotten that service from this organization. It just builds that camaraderie and that trust in the organization that, hey, I'm in good hands. They refer here frequently. There's a good partnership. We see the communication. And that to me is what really makes that patient feel special when they know that you're putting them in good hands.
But yet did many of these hospice leaders that are listening right now, did you know a good FQHC has got incredible behavioral health services? This is an oversimplification, but what my antenna when you and I were having that campfire conversation is, wait a minute, I've never thought about, you're this incredible primary care wraparound, but has a whole bunch more robust services. I go and try to partner with primary care people all the time as a referral source. Have many people thought about you as a referral source to them?
Think of us as partners. We really do have that community focus at our community health centers. We're looking to do as much as we can with the resources that we have. And the more connections and community partnerships that we have, the better we feel that we can serve our patients moving forward.